I'm Becky Bells, microbiologist at Clinch Valley Medical Center, and I will be going over the collection of blood cultures. Physicians usually order a set of blood cultures 15 minutes apart. When we talk about a set of blood cultures, we are saying one pediatric bottle or two bottles, which is one aerobic bottle and one anaerobic bottle. Pediatric bottle is used for pediatric patients or for patients that are hard to obtain blood specimens from. Each bottle has a certain amount of blood that is required. In the pediatric bottle, we need 1 to 3 mLs, and each aerobic and anaerobic bottle, we need 8 to 10 mLs. Each set of blood cultures should be drawn from a different venipuncture site. If a catheter-related bloodstream infection is indicated, one set should be drawn from the catheter site and a separate set from the venipuncture site. The blood cultures must be started before antimicrobial therapy if possible. The antimicrobial therapy can affect the bacteria growth in each bottle. Blood cultures can be collected using a vacutainer, needle and syringe, or butterfly set. Each bottle is marked with 5 ml increments, and it's recommended, in order to make sure that you get the right amount of blood, that you measure the appropriate amount you need by placing a mark on the bottle. When removing the bottle to check the amount of blood, you will be able to see when you reach the line. The bottles are also vacuum, and you cannot leave the bottle on because it will overfill. You also want to inspect each bottle for cracks or cloudiness in the liquid. You also want to flip the cap off, check the rubber stopper to make sure it is not bulging. If any bottle has any defect, please replace the bottle with a new one. On the blood culture bottle, you want to swab the septum with an alcohol prep and let it dry. Then you want to start prepping your patient. You want to pick the venipuncture site, use an alcohol prep to clean back and forth the site. Then you want to use a ChlorPrep swab. Starting at the center of the venipuncture site in a circling motion, working your way outwards from the center. After cleaning with the ChlorPrep, do not touch the venipuncture site again. That will cause contamination. If you have any other laboratory tests ordered, you must draw the blood cultures first and then any additional laboratory tubes. Blood cultures cannot be drawn in any other tubes and transferred into the blood culture bottles. Certain additives are in the different tubes, and they can be toxic to the bacteria and affect their growth. After collection of the blood cultures, the bottles must be inverted to prevent clotting. The transportation to the lab must be within 2 hours. If it extends greater than 2 hours, the blood cultures are invalid and will not be accepted. If you have any questions or concerns on how to collect blood cultures, please feel free to call the laboratory or talk to the microbiologist. My extension is 5142.